I'll share the slides. Definitely, there is a lot of content. There is reason for it. I want definitely, this is the first largest conference on AI, which is international, done by Yashoda hospitals. Great initiative. These are the pillars. There's a lot of content. This is coming from policy-making perspective. And large hospitals really need to take that initiative. They need to build these kind of bodies where all of these things can be done, which is clinical validation pipeline. There has to be auditability of documentation. There has to be open data and transparent algorithm system. So Telangana government has just recently started initiative of DEX, which is a data exchange. It's a DPI system. A lot of these terminologies are not generally used by healthcare fraternity, but again, if you look at it in the newspaper, you'll find this. And that's where a lot of anonymized data from different vertical is now being given to startups. So the challenge will become a little bigger because while government is trying to do that, there are policies being made. A big role has to be played by the healthcare fraternity on that part. And last part, you need to be part of the neutral bodies for certification in India. If you propose some of these kind of things, then only we will have a mechanism of filtering out startups or products which are not doing well, because government will take a little longer when it comes from a national standard perspective, but while you adopt, you need to enforce some of your certification methodologies. And being the early setter of this trend, the biggest advantage is this will be replicated other ways around by the government. So those are 4 critical areas to really think about when you're building a framework in AI healthcare governance. So role to play, as I said, private hospitals, private practitioners, and public systems, all 3 of them have to do that filtering mechanism by building these kind of associations, by building these kind of mechanisms, ensuring any product while it was being built, if it did not have real participation, and who were these participants, how it was used. I mean, like how, just now we heard from another panelist asking the previous presenter about where this is implemented, how it is done. I mean, these are very critical questions to figure out like the depth of those solutions, and it's really important for us to figure out, can we go use this? Because while the demos are made, it might look great, but the proof is in the pudding, and then you have to validate that. On the policy recommendation side, again, there are 2 areas. One is government is playing a role on building AI sandboxes, which will take some time, but again, those sandboxes are mechanism. But if you can look at those methodologies, your questions will be formed while you're making your own committees. Which is like, do you have in-house AI authority built? Do you have a committee like ICMR kind of sandbox dashboard enabled for people? So I think I'll just quickly conclude. There are 3 things. This is the last slide. Ultimately, my request is we need to build alliances between doctors, AI developers, and policymakers. That is very critical if you really want to address real challenges. The real challenge is not getting replaced by an AI, but again, the real challenge is like patient getting misdiagnosed by AI, and I feel that's what policymakers can really play a good role, and you have to play a critical role in this. Healthcare AI must be safe, as we know, and it should be socially accountable. That's much critical for all of us. And we know we have to ensure any product that has been made and you're adopting that, there has to be a medical practitioner, clinician in the loop. I think that's it from my side. Thank you for your time.